So today's presentation is from the American Academy of Pediatrics. It's based on and focused on infection prevention, control, vaccination during the COVID-19 pandemic. So these are just brief acknowledgements. Project First Line is a national collaborative led by the U.S. Centers for Disease Control and Prevention to provide infection control training and education to frontline health workers and public health personnel. So AAP is a proud partner with Project First Line as supported through cooperative agreement. CDC is an agency within the Department of Health and Human Services, and the contents of this program do not necessarily represent the policies of CDC or HHS and should not be considered an endorsement by the federal government. So my name is Sayeda Sabrina Afzal. I am a second-year pediatric resident at Ochsner LSU in Shreveport, going into my third year as a chief resident. So I will be doing this presentation. So disclosures, I have no relevant financial relationships with the manufacturers of any commercial products and or provider of commercial services discussed in the CME activity. I do not intend to discuss an unimproved or investigative use of a commercial product or device in our presentation. So the objectives of this presentation is to understand infection control practices before, during, and after administration of vaccines, including COVID-19. It is also to understand infectious control strategies for vaccine administration during the COVID-19 pandemic. So addressing immunization rates, efforts to reduce transmission of severe acute respiratory syndrome due to the coronavirus 2 have led to decreased use of routine preventative medical services, including immunization services. So I'm sure as a lot of us have seen during the COVID-19 pandemic, a lot of the outpatient clinics were having fewer and fewer patients come in for their routine visits. Ensuring that routine vaccination is maintained or reinitiated during the COVID-19 pandemic is essential for protecting individuals and communities for vaccine preventable diseases and outbreaks. This is especially important in our pediatric population when we do a lot of the routine vaccinations to prevent diseases from occurring. Routine vaccination prevents illnesses that lead to unnecessary medical visits, hospitalizations, and further strain on the healthcare system. The AAP also developed office strategies for improving immunization rates. And in that link, if you click on it, it talks about putting in things such as standard orders. It also talks about holding family-friendly office hours for families that are really busy with work. So it's more available for families to come in to get vaccinated. Also, it talks about signing an immunization champion for your practice, which will really help because there's that one member of the team that will be a steward advocate of immunizations. And also the important thing is just providing a strong recommendation. A lot of families do trust their pediatricians. So obviously telling them information about the vaccines and providing them with important relative statistics about, what can the vaccines do if you don't take them. Especially it's important, like for instance, if we use an example of the HPV vaccine, a lot of times that's one of the ones that become optional. And if we give information on why we think that is more necessary, then parents and families will be more lenient towards accepting that vaccination for their children. Connecting with families, which is what I was briefly touching up on, communicating the importance of vaccination to parents and patients, our caregivers. Even in our clinic over here at LSU Shreveport, a lot of times families will ask, well, what is this vaccination for? So we oftentimes even give out handouts during our clinic visits and afterwards, because that provides something that they can refer back to about the importance of the vaccination that we're giving them or recommending to give them. Share the infection control safety protocols and procedures implemented to help provide reassurance to those who may otherwise be hesitant to present for vaccination visits. The AP actually has a hashtag campaign, so Call Your Pediatrician campaign, which aims to reach parents with timely reminders that going to the pediatrician, even during the COVID-19 pandemic, is important and safe. So before the visit, setting up the office to ensure the safe delivery of care during vaccination visits, providers should one, screen for symptoms of COVID-19 and contact with persons with possible COVID-19 prior to and upon arrival to the facility. So at our clinic over here at Oshner LSU, at our ambulatory care center, we do have members of staff outside before the patients come in to check their temperature, check their vitals, and ask them if they have any symptoms of COVID-19. Limit and monitor points of entry to the facility and install barriers such as clear plastic sneeze guards to limit physical contact with patients at triage. So again, at our clinic, there's multiple entrances, but during the pandemic, we only had a certain main entrance open for patients and faculty to come through. Implement policies for the use of well-fitting face covering in person over the age of 2 years old if tolerated. Ensure adherence to respiratory hygiene, cough etiquette, and hand among office staff and patients or families, especially like with hand sanitizers, having signs to make sure you know that you use a hand sanitizer every time you're leaving and entering the building. Ensure proper PPE supply and healthcare provider awareness for proper PPE. So making sure we have enough masks for patients and faculty and members in the office building. Administering vaccinations. The AAP recommends eye protection and face mask during the administration of vaccines, as there may be a risk of exposure to saliva, tears, or coughs if the children cries. And I'm sure with pediatricians, we all can relate to that. Gloves should always be considered depending on the patient's interaction. A face shield may be worn to maintain cleanliness and allow for extended use of face masks. Children over the two years of age should wear a well-fitting face covering, which will help protect healthcare personnel from coughs and saliva. For children under two and children who cannot remove their mask on their own, face coverings are not recommended. So healthcare personnel may consider increasing their level of PPE while administering a vaccine to these patients. There is no data specifying the transmission risk for administering vaccines during the COVID-19 pandemic. Additional office-based strategies for vaccine administration. Additional infection control strategies to consider when administering vaccination should include holding vaccination clinics. So the CDC offers considerations for holding vaccine clinics during the COVID-19 pandemic, including physical distancing, PPE, and enhanced sanitation efforts. So like I was saying before, having signs in your office to remind patients and staff to sanitize when they're coming in and out of the building or in and out of a patient's room. Vaccination services provided outdoors if practice or setting or location allow. Example, curbside drive-through tents. We actually have a vaccination drive-through here in Shreveport, and that's specifically for the COVID-19 vaccine as well. Separate vaccination stations from other patient care areas. Stagger appointment times to minimize the number of people in the waiting room or waiting in their cars, which is important because it decreases and keeps which is important because it limits the amount of people in one area, so therefore limiting the spread of infection. So a lot of times there's questions about the vaccine vial itself. So single dose or multi-dose. So not all vials are created equally. So we have to keep that in mind. Dozens of recent outbreaks have been associated with reuse of single-use vials and misuse of multiple-use vials. As a result of these incidents, patients suffer significant harm, including death. So the CDC and the One and Only campaign urge healthcare providers to recognize the difference between single dose and multi-dose vials and to understand the appropriate use of each container type. So in the presentation, there is a link that answers questions about multi-dose vials and what we should do when we are using them. For instance, for a multi-dose vial, it should kind of be dedicated to a single patient whenever it's possible. But if it needs to be used more than once for a different patient, so for more than one patient, they should be kept in only in like a safe area, like the nurse's station and away from immediate patient treatment areas. An example of immediate patient treatment areas are like operating rooms, procedure rooms, anesthesia, procedure carts, things like that. Disposal of administration devices. Immediately after, all syringes, needle devices should be placed in a biohazard container that are closed, puncture resistant, leak proof on sides and bottoms, and labeled and or color coded. Empty, expired, or compromised vaccine vials are usually not considered hazardous or pharmaceutical waste and do not require disposal in a biomedical waste container. Contact the state or local immunization program or state environmental agency to ensure compliance with state requirements. Infection control after healthcare personnel vaccination. Staff will still need to follow routine infection prevention and control practices after receipt of the COVID-19 vaccination, including implementing telehealth and nurse-directed triage protocols, screening and triaging a healthcare facility for signs and symptoms of COVID-19, implementing universal source control measures, including wearing a mask, encouraging physical distancing, and managing visitor access and movement within the facility. So infection control procedures should still be enforced, as it will be some time before there is evidence that the vaccines not only prevent illness in a person who is vaccinated, but also prevent them from transmitting the virus. So I know a lot of states are removing the mandated mask requirement, but in a health care setting in our clinics and in our hospitals, we still have to be mindful of infection prevention and still follow these guidelines. So just a closing statement, proper infection control when administering the COVID-19 vaccine and other vaccines is important to reduce risk for patients, families, and staff. Safe disposal of the administration devices is critical for the safety and healthcare personnel, Continue to encourage infection control procedures for staff and family, even after receipt of the COVID-19 vaccine. And the important thing to always remember is to educate patients on why vaccines are important and what vaccine they're getting. A lot of times, especially with stuff that's on the media, patients and family members are very hesitant. So the biggest thing that we can do and the best thing that we can do to help our patients and our families is just to educate them on the types of vaccines, what they're preventing, how they work. And I feel like, especially in our personal experiences over here at Austin or LSU, we do see that really helps. Educating the families really help them to understand what is important and why it is important. Going back to normal is going to take all of our tools. So if you want to go back to how it was before, we have to use all of the tools that we have. And if we do that, we stand the best chance of getting our families, communities, schools, and workplaces back to normal sooner. So get vaccinated, wear a mask, stay 6 feet away from each other, avoid big crowds, and wash your hands often. And these are just some resources that we were talking about and what we used in the slide. So it's very important to go over these guidelines and resources, and maybe some of the questions that we may have can be answered by these resources.